Hi there, I am Dr. LaQuita J, and welcome to my YouTube channel where we talk about all things in between being and becoming a pharmacist. How you doing? You all right? So this is our last video on learning your studying to your learning style, and we talked about it. We sparked visual was the first one, auditorial, reading and write, and now our last one is kinesthetic learner. And kinesthetic learning is all about hands-on. So today I want to give you a couple quick tips about how you can learn as a kinesthetic learner. And like as I mentioned before, kinesthetic learners, they're all about learning the style that requires manipulation through touch and hearing the material. So it's really like a tactical kind of technique, which is basically combines auditorial and visual learning techniques. It's like a multi-sensory type of learning. So that's what makes kinesthetic unique. And again, it's like hands-on. So again, if we were going to the analogy I talked about in the very first video of remembering the study session I had with these group of women. So we had a whiteboard and we were learning a subject, and it started about saying, okay, let's move on one thing, breaking it down. And they have first of all, it's reading and writing, because we're writing notes down. We're writing of how we're going to remember this information, particular disease state. And then it starts with visual learning, because it's on a whiteboard. I can see it organized in an outlined format. And then repetition comes with auditory learning, because I'm constantly reading and seeing. But it is also, it comes kinesthetic, and saying like, okay, hands-on, but how am I going to remember this information kind of thing. So today, and kinesthetic being like thinking of scenarios and stuff like that. And today, that's what we're going to talk about, like different ways of scenarios you can do, how you can implement kinesthetic learning when you're studying. And the first is always going to be is group sessions. You may truly benefit from group sessions because you get a chance to explain something hands-on. Like, I can teach you something. I can teach you this disease state. So that's one form of hands-on. Other way may be, second way would be like thinking of scenarios. Like, think about the case-based scenario. Like, how truly would a patient show or display this particular thing? Like, for example, good example, statins. Your statin cholesterol drugs, they have the key side effect of rhabdomyolysis, right? So the thing is, with rhabdomyolysis, objectively, you will look at the patient's CPK levels, and of course, if it's increased, that means the muscle has broken down. However, when it comes to you are going, you're thinking about like subjectively, how will this patient present? The patient's gonna complain about muscle pains. So it's one of the key things saying, okay, so patient such and such, SM, 45-year-old female, walks to the farm, starts talking about muscle pains. You discover that she recently started taking cholesterol medications about 3 months ago, and she's complaining about having so many muscle pains. That's a key thing to say, like, oh, this will be a key thing she can look out for. And we were saying, if a patient came in saying, hey, look at me, I have these bumps on my chest, and looking at the little blisters and like on their stomach, you realize, oh, the patient has shingles. It's like, think about those kind of things of how it looks. Not just saying like, oh, patient has a shingles rash on their back and how we treat it. Okay, but how does the patient present? That's more so your kinesthetic learning. You think about scenarios for the particular patient. Also, another way you learn as a kinesthetic, or you have to implement, is sometimes kinesthetic learners, they like having things, like if it's a stress ball or having something you can hold, you can have that touching sensation. So people like to chew gum or like pace, like kind of thing, get their attention, tap your foot. That's one of the things you can do. Like kinesthetic, like it's the multi-sensory type of learning. So that may be a thing of, okay, when I'm learning, I'm tapping, so I keep a pace of how the movements to increase like your intention. So that may be one thing when you're learning. Fourth thing can be, when I say not can be, fourth thing for kinesthetic learners may literally be like having a partner, not necessarily a study partner. It could be like your friend, your spouse, or significant other, just sitting here, not saying it had to be well versed in information, just a quiz kind of response, like quizzing out loud, where you or you can quiz yourself in the mirror. It's more kids to like, it's like real world, real like active kind of things, because you like that. And again, it comes with stuff for the Naplex. There's not a lot of opportunities for you can have hands-on learning, but you can do those kind of things, like again, like your body language, like you may be like the one to like the fidgeting type person. You can do that kind of body response trick to learning. You can also do I'm sorry, look at me, I'm sorry, I'm so sorry, I just drew a whole blank, but it's okay. It's okay. I totally forgot, but it's okay. I digress. But kinesthetic learning, those are some quick ways you can do it, especially study groups. That's definitely one. We may not have the time for, like I said, it's hands-on, so we don't necessarily have labs and stuff like that when you start preparing for the Naplex. But you can also do like your notes. Again, it could be a kind of you speaking it out and you reciting it, that form of active recall as well. But kinesthetic learners, it's more so your motor sensors are when you're studying, like you're studying and you have a sense of repetition and you're like clicking and tapping to help you remember things. So those are different ways. I really hope you have enjoyed this series of learning styles and learning to your styles. That's one of the key things. But I always say this, one key thing before I forget: if you are a person who likes to move your body and while studying, not reviewing, the key thing is you don't want to necessarily move too much when you're in the exam room, because they may think, hey, all right, they may think you're doing something wrong. Why this person keep moving? So I'll just say, just be mindful of that with your body language. But that is all. Again, I do hope you have enjoyed the series. I have enjoyed creating it, especially when talking about your learning style, because that's something that we just don't talk about as much. And I do hope that you embrace, if you are a kinesthetic learner, you do embrace this learning style. And just remember that movement is not just a distraction. It's your catalyst for understanding information. This is how, like, you need that scenarios, you need to talk, because this is how you learn. And if you have enjoyed this series of learning styles, with this mini series in the series learning styles, please give this a thumbs up, like continue to subscribe to our channel, and please let us know in the comments below. Like, share your experiences of kinesthetic learning. Do you like it? Again, are more so, are you or the other learners, like, you do a combination of how do you use kinesthetic learning? Because kinesthetic learning is a combination of visual and auditorial, and reading and writing. It's a combination of it, but how do you use it? So feel free to drop it below. Thank you for watching, and as always, until next time, remember that pharmacy is unlimited if you are. Now, peace and go be great.